The House will come to order. Prayer by the chaplain.
As the world awakens each spring, moving from death to life, so too we are awakened today, awakened to the past that we never forget the innocent, awakened to the present needs of your world, awakened to the promise of your presence, and awakened to your call to do great things. The tasks before us are challenging. How can we take care of so many and so much? And so as you call out to us, we call out to you. Help us govern with you, through you, and in you. Teach us to make friends with our questions and our doubts, to see them not as signs of weakness to be avoided, but thin places where we can better discern your gentle whisper. And at the end of the day, may we find peace, knowing what pleases you most is not any of our accomplishments, but rather our desire to want to please you.
The chaplain for today is Reverend Dr. Charles Ortloff from Gloria Dei Lutheran Church, Rochester, Minnesota. Please remain standing and recite the Pledge of Allegiance to the flag of the United States of America. The clerk will take the roll.
How you doing?
The clerk will close the roll. Quorum is present. The clerk will read the journal of the preceding day.
Journal of the House, 90th Session, 2017, 45th day, St. Paul, Minnesota, Thursday, April 20th, 2017.
If there is no objection, further reading of the journal will be dispensed with, and the journal will be approved as corrected by the chief clerk. Hearing no objection, the journal is approved as corrected by the chief clerk. Comparison reports. There's a copy of this order of business on each member's desk. If there's no objection, the motions will prevail. Hearing no objection, the motions prevail and the substitutions will be made. Second reading of Senate files.
Second reading, Senate file number 870.
Second reading.
Second reading, Senate file number 1020.
Second reading. Introduction of bills. The following House files have been offered for introduction today. The chief clerk will report the House files and give them their first reading.
Introduction of first reading of House files 2610 through 2615.
First reading, House files 2610 through 2615. Messages from the Senate.
Message from the Senate, Mr. Speaker, and this is the Erickson motion. I hereby announce the passage by the Senate of the following House file, herewith returned as amended by the Senate, in which amendments to concurrence of the House is respectfully requested. House file number 140, an act relating to education. The message is signed Cal R. Ludeman, Secretary of the Senate. Erickson moves that the House refuse to concur in the Senate amendments to House File Number 140, that the Speaker appoint a conference committee of 3 members of the House, and that the House requests that a like committee be appointed by the Senate to confer on the disagreeing votes of the 2 houses.
Recognize the member from Mille Lacs, Representative Erickson, to your motion.
Thank you, Mr. Speaker and members. This is the teacher licensure file. We do not want to concur with the Senate. We have a few differences, so I ask that you appoint 3 conferees. Thank you.
Discussion on the motion to refuse to concur. Seeing no discussion, all those in favor signify by saying aye. Those opposed, no. The motion prevails.
A message from the Senate, and this is the Garofalo motion. Mr. Speaker, I hereby announce the passage by the Senate of the following House file, herewith returned as amended by the Senate, in which amendments to concurrence of the House is respectfully requested. House file number 600, an act relating to employment. The message is signed Cal R. Ludeman, Secretary of the Senate. Garofalo moves that the House refuse to concur in the Senate amendments to House file number 600, that the Speaker appoint a conference committee of 3 members of the House, and that the House requests that a like committee be appointed by the Senate to confer on the disagreeing votes of the 2 houses.
Recognize the member from Dakota, Representative Garofalo, to your motion.
Mr. Speaker, that is my motion.
Any discussion on the Garofalo motion to refuse to concur? Hearing no discussion, all those in favor of that motion signify by saying aye. Those opposed, no. Motion prevails.
A message from the Senate, and this is the Gunther motion. Mr. Speaker, I hereby announce the passage by the Senate of the following House file, herewith returned as amended by the Senate, in which the amendments to the concurrence of the House is respectfully requested. House file number 707, an act relating to state government, appropriating money from the Outdoor Heritage Fund. And the message is signed Cal R. Ludeman, Secretary of the Senate. Gunther moves that the House refuse to concur in the Senate amendments to House file number 707, that the Speaker appoint a conference committee of 5 members of the House, and that the House requests that a like committee be appointed by the Senate to confer on the disagreeing votes of the 2 houses.
Recognize the member from Martin County, Representative Gunther, to your motion.
Mr. Speaker, that is my motion.
Any discussion on the Gunther motion to refuse to concur? Seeing no discussion, all those in favor signify by saying aye. Those opposed, no. Motion prevails. Announcements by the Speaker.
Announcement by the Speaker. The Speaker announces the appointment of the following members of the House to a conference committee on House file number 140. Erickson, Bennett, and Mariani. Announcement by the Speaker. The Speaker announces the appointment of the following members of the House to a conference committee on House file number 600. Garofalo, Baker, and Poppy. Announcement by the Speaker. The Speaker announces the appointment of the following members of the House to a conference committee on House File Number 707. Gunther, Fabian, Torkelson, Green, and Lilly.
Messages from the Senate.
Okay. A message from the Senate. Mr. Speaker, I hereby announce the passage by the Senate of the following Senate files herewith transmitted. Senate file numbers 799, 844, 1030, and 1031.
First reading of Senate files.
First reading of Senate file number 799, an act relating to state government. Dean M. moved that Senate file number 799 and House file number 943, now on the General Register, be referred to the Chief Clerk for comparison. Hearing no objection, so ordered.
Hearing no objection, so ordered.
First reading Senate file number 844, an act relating to the environment. Fabian moved that Senate file number 844 and House file number 771, now on the General Register, be referred to the Chief Clerk for comparison.
Hearing no objection, so ordered.
First reading Senate file number 1030, an act relating to corrections. The bill is being referred to the Committee on Public Safety and Security Policy and Finance. First reading Senate file number 1031, an act relating to corrections. The bill is being referred to the Committee on Public Safety and Security Policy and Finance.
Hearing no objection, so ordered.
That's it.
Calendar for the day. The first bill on the calendar for today is House File 809. The clerk will report the bill.
House file number 809, number 1 on the calendar for the day, an act relating to health.
Recognize the member from Douglas, Representative Franson, to introduce your bill.
Thank you, Mr. Speaker and members. Members, the purpose of this bill is very simple. House File 809 would stop the use of taxpayers from paying for abortion. It would do this by having Minnesota follow the same policy as the federal government, which has prohibited taxpayer funding of abortions for decades, with the exception of abortions done to save the life of a mother and in cases of rape and incest. Only one program would be affected by this legislation, and it is the state's Medicaid program. The federal government already prohibits taxpayer-funded abortions for women on Medicaid. Additionally, Minnesota's other programs already prohibit taxpayer-funded of abortions except in the cases of saving the life of the mother and in the cases of rape or incest. This legislation would apply the same restrictions to medical assistance. My constituents and I do not feel that we should be paying to end the life of an unborn child with an elected procedure called abortion. I believe that women deserve better than abortion. Providing free abortion does nothing to help women. In fact, it leaves that woman without her child. I think the state is better off providing real help and support to pregnant women. And for those who don't want to or are unable to raise that child, we should be doing more education on adoption. From 1978 to 1994, Minnesota law prohibited taxpayer funding of abortions, except in cases of reported rape, incest, and the life of the mother. That all changed in 1995. Since 1995, taxpayers have paid for over 77,000 abortions in the excess of $23 million. For those of you on the other side of the aisle who are going to say that this is going to create discrepancies between women who are unable to afford an abortion and with those who are of means, I did some research this weekend, and actually there are organizations that do provide funding for abortions. Abortionfunds.organization, you enter in the zip code and you can see right in Minnesota what organizations will give you some financial assistance. And then there's an abortion assistance fund on prochoiceresources.org where they provide no interest loans and grants to those who do want an abortion but unable to afford it. So even without taxpayers funding abortion, there are still resources out available for those who want to end the life of their child. And with that, Mr. Speaker.
There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, House File Number 809.
Third reading. Discussion on House File 809. The member from Olmsted, Representative Liebling.
Mr. Speaker and members, here we go again. We've had this same debate over and over in the time that I've been in this legislature, and it seems to never get old for those who want to bring these kind of bills to tell women what kind of health care they should be able to get. You know, it's interesting that Representative Franson mentioned some places where people can get perhaps some funding if they want an abortion and they can't get it funded through their health insurance. And I'm sure that there are some women in other states who probably need that information, and there are probably some women who don't qualify for Medicaid, medical assistance in Minnesota, who probably are grateful for that information. So thank you, Representative Franson, for sharing that. But nevertheless, we don't tell women that if they want, you know, other kinds of health care, that they should go and seek charity to be able to have that. Whether a woman wants to carry a child to term or you know, there are a lot of things that can happen in women's lives. We had a press availability this morning, and we heard from 3 women who have had abortions, and they discussed their very different circumstances in which those things occurred. Now, none of them talked about whether they were on Medicaid or not, but it shouldn't matter. It shouldn't matter how a woman gets her health care, how she gets her insurance. It ought to be her own business. Her own business, whether she feels that she can carry the pregnancy to term or not. And you know, the portrayal of women as doing this for some kind of frivolous reason is so unfair and so inaccurate. And when you listen to women who have gone through this experience, you know, one of the women was talking about having a fetal anomaly that was incompatible with life. You know, to say to that woman that we, the politicians, are going to tell her that she can't make a decision about what to do about that pregnancy with privacy, with her health care provider, with her husband, with her clergy, that is just wrong. You know, it just strikes me that we so often hear the Republican Party talking about limited government and local control. Boy, we have sure seen that those things really don't mean anything this year. We've seen it in a lot of places, but we sure see it in this area. Limited government, but not too limited to tell women what they can do with their own very, very private, personal decisions.
The member from Washington, Representative Lomer.
Thank you, Mr. Speaker and members, and I want to thank Representative Franson for carrying this bill today. You know, I'm very saddened with every speech that I hear that supports abortion today, and I'm sure there will be more than Representative Liebling. Abortion is the taking of a life, a young life with a beating heart. Since Roe versus Wade in the 70s, over 60 million children have been aborted, and over 60 million women have had to live with the consequences of a decision that has lifelong consequences. Abortion may be legal in this country, but no taxpayer should be forced to participate with their tax dollars for the taking of this life. I had a bill last year to redirect funds from Planned Parenthood to comprehensive health clinics to truly help women in crisis and in need, and it would have saved the lives of the lives in the poor and minority communities. That was my goal. It's ludicrous to say that we don't care about poor women. We do, and we know that abortion hurts all women. I hope they're passing out a story. Yesterday on the front page of the Minneapolis paper, You may have seen the story of my good friend Michaela Holmgren. And some of you might remember this young woman. She's 22 years old, and she has Down syndrome. She was in committee several years ago testifying to my bill, which required physicians to give complete, up-to-date, and accurate information to expectant mothers who find they are carrying a baby with Down syndrome. Michaela did a fantastic job of testifying, using her cell phone to read her testimony, and I was so happy to see that the governor signed that bill. Taxpayers have been forced to pay for abortions for women on medical assistance whose unborn children have birth defects and disabilities, as if those children are not valuable and do not have any worth to our society at large. You've all heard me talk about my son with spina bifida. He works at Gillette Hospital and helps children every day who are getting ready for surgeries. He's the one that's had over 80 surgeries, by the way. And he's there to help them post-op as well. Often he's the one they call up to the floor to encourage kids who need a bit of encouragement to get up and walk post-surgery. Those kids and families love my son, and who can relate to them and their fears like no one else. So Michaela, when you get the story, you'll see it. She will be running in the Miss Minnesota beauty pageant, and I'm so thrilled that she's been accepted to be a candidate. To quote Jordan Buckalow, director of the Minnesota Miss Amazing pageant, to have women from all walks of life truly be represented on stage shows that pageants are accessible for all, and beauty isn't just a box that we can fit in. Michaela is a joy to all who know her and is an encouragement to all of us, but especially those in the disabled community. Michaela's life is precious. All life is precious. Over 60% of people in this country do not support their tax dollars being used to fund abortion. I stand with that majority, and I ask you today for a green vote. Thank you.
Recognize the member from Anoka, Representative Whalen.
Thank you, Mr. Speaker, and thank you, members. Thank you, Representative Franson, for carrying this bill. I want to echo some of the things Representative Lomer stated, but first also just to respond to Representative Liebling's comment about here we go again. Members, the truth doesn't change. We will keep going because abortion is ending a life. It takes a life. I didn't decide this, God did. It's very clear in the Psalms, He knits us together in our mother's womb. You might not agree, but I hope we can agree that I shouldn't be forced to violate a sincerely held belief with my taxpayer dollars going to fund abortion. I really like the way Representative Lomer phrased it. No Minnesotan should be forced to participate in the taking of a life. And members, there are alternatives. There are so many groups that want to reach out and help these women. And so I would just encourage you, do a quick online search, alternatives to abortion. There are many resources available. Our tax dollars could be spent better places. Thank you.
I recognize the member from Dakota, Representative Halverson.
Thank you, Mr. Speaker. And I have to rise in support of the women of Minnesota, of women of means, of women who are struggling financially. And recognize the fact that all of these women, regardless of their financial situation, deserve access to comprehensive health care. And they deserve it in a situation that provides them dignity and privacy and scientifically proven care. They don't deserve the judgment of the Minnesota State Legislature when they're making their health care decisions. And I've heard members already today talking about women who seek abortion like they should be shamed, like they are somehow damaged human beings, like they are somehow incapable of making their own health care decisions. And so I'm standing up for the women of Minnesota who I know are strong, smart, capable. Some have said above average on a certain radio show. And that's the way that the Minnesota legislature should treat them. There's not something wrong with the women of Minnesota that we need to get involved in their health care decision making. But for people who want to, And I mean, and I think it's perfectly fine for people to make their opinions known, to talk about your values around, familial values around abortion in your families, in your faith community. Those are important things to talk about. Your truth is important to understand, and so it's perfectly fine to have this conversation, but it's not okay for the legislature to tell women that they don't deserve the same privacy and dignity and care based on their financial circumstances. So that's the first thing I'll say. The second thing I'll say is we're debating this in the legislature, but the fact is this is no longer a legislative issue. The state Supreme Court has spoken. The state Supreme Court has spoken on the side of justice for women who are not wealthy. The state Supreme Court has said that there needs to be parity in terms of the health care that wealthy women receive and that poor women receive in this state. And because of that, women have autonomy to make their own health care decisions. Women have autonomy to make their own decisions about when to become a parent and whether to become a parent. And those healthcare decisions extend far beyond abortion. The fact is we need to make sure that the entire range of comprehensive health care and health education are available to the women of this state, regardless of their financial situation. And so I stand for the women of Minnesota to say, I trust you to make decisions for your own health care, and I, as a state legislator, am not going to take away your dignity or your privacy.
The member from Ramsey, Representative Murphy E.
Thank you, Mr. Speaker, and thank you, members. I wish we weren't doing this bill today or any day, really, especially when we've just got 4 weeks left, no budget targets. Minnesotans expecting us to adopt a budget, deal with transportation, pass an infrastructure bill, but here we are, wasting our precious time. Representative Lomer, in her speech, said that she believes that abortion hurts women, that it causes harm to women. We've heard that before on this floor. I know there are members that believe that, though I'm not quite sure where you get your belief, though I, would attest to the fact that you believe it. What I hear from women about what hurts them when we continue to take up this political issue is that by your action, yours and the members of your caucus, you are inserting yourself and your views into a decision that should be between a woman and her family and her faith community, her pastor, and her physician. We have no business in the middle of that. We have no business being in the middle of that private decision. And yet you insist inserting yourself in there. The other thing that hurts women each time we take this step is we are telling them that they're not capable of making this decision for themselves, that they're not capable or entitled to make this decision for themselves, that we believe we're smarter than they are. And I think it's time to knock it off.
The member from Anoka, Representative Scott.
Thank you, Mr. Chair. And as Representative Halverson stood and said she's standing for the women of Minnesota, I'm going to stand for the women of Minnesota too, the ones that have not yet been born. If we look at the statistic that since Roe v. Wade passed, 60 million children across this country have been aborted. Their lives have been snuffed out. Approximately half of those were women. So if we look around our country today, approximately 30 million women are missing. So I'm here to stand for their rights.
The member from Ramsey, Representative Lesh.
Thank you, Mr. Speaker. Members, when we do these bills, we invariably stand up and talk to our own base, our own constituency. And some people who come up to the Capitol and watch, they think we're here and we try to persuade each other in this great debate. And that's not going to happen today. That won't happen on this issue as long as I'm alive, I don't think. But I am going to take a different tack today. Mr. Speaker and members, because some of the things that I've heard revealed to me that there is no desire to persuade. There's no desire to reach an understanding. When I hear someone call Representative Liebling pro-abortion because she believes in a woman's right to choose, you didn't see my eyes roll, but they did. When I hear someone being so convinced that it's a life and needs to be protected, I will reveal one thing to many of you that do not know this about me. When I was in high school, I marched in pro-life marches. I did. Grew up Catholic. And then I went to college and I understood the nature of our country, how we make laws, and how we do not impose faith or religion upon others. It is a foundation of our country. And so you may believe all day long that it's a life at conception, and congratulations. But you cannot impose that faith upon another. You may believe it as much as the day is long. You may say, absolutely, I'm convinced. But I have an undergraduate degree in philosophy, not just philosophy, but Catholic philosophy. I went through the entire rigmarole. I could repeat this debate ad nauseum, but the Constitution protects persons. And you came up here, and if you swore an oath, you may have put your hand on a Bible and swore an oath to uphold that Constitution. You did not place your hand on the Constitution and swear to uphold the Bible. It's been said before, and it's just as valid now. But until you put your morals where your mouth is, and I see you passing legislation that shows you are pro-life, not just pro-birth, when I see legislation that supports children's health care, affordable child care, early childhood education at MFIP, I might start to be persuaded in the sincerity. But that's not going to happen today based on what I've heard. I sincerely hope that someday, maybe it will.
The member from Carver, Representative Pugh.
Thank you, Mr. Speaker. Minnesotans don't want their tax dollars to be spent funding abortions. In fact, there are 33 other states in the federal government who have this measure that we're discussing here today in place. This legislation to ban taxpayer funding abortion is very important to me, as it is to my district, especially given that I represent one of the highest tax districts in the state of Minnesota. This legislation has been criticized in the past. In fact, it's been criticized right here today on the House floor, that it's a waste of time and that this legislation shouldn't pass because it's unconstitutional. But members, it's our job as legislators. It isn't our job to decide what's constitutional and what isn't. That is the job for the courts. As legislators, it's our primary responsibility to represent our individual districts and the constituents that we serve. In fact, I've heard from Minnesotans all across the state who know what my position is on this issue, and I think I've heard from them because they want to be heard, and I was somebody who listened to their concern. The issue of abortion, and much more specifically, and that's what we're here to talk about today, whether our tax dollars should pay for others' abortions, is a concern I hear about from my constituency on an ongoing basis. In fact, as a result, it's clear to me that a majority of my constituents, including some who are pro-choice, do not want their taxpayer dollars used for this purpose. I've spoken with constituents who believe this. I ask for your support on this legislation because I sincerely believe it's the right thing to do, and because I believe most Minnesotans believe that this is the right thing to do. So I thank you, Mr. Speaker, I thank you, members, and I thank you, Representative Franson, for having brought this bill.
The member from Hennepin, Representative Loeffler.
Well, thank you, Mr. Speaker and members. You've heard me many times speak about the need for comprehensive health coverage for all. And we've dealt with that in many steps forward since I was first elected, from debating having preventative care covered outside of high deductibles, from ensuring that children under age of 5 didn't get branded with pre-existing conditions because they had a headache that wouldn't go away, and their parents took them to the hospital emergency room, and it went away on its own. And 2 years later, when their employer dropped family coverage, that little boy, 4 years old, couldn't get coverage because he had a pre-existing condition, because he had a headache at 2 and couldn't communicate enough about what was happening, so they took him in for care. Well, this to me is just another step backwards in saying that we believe in comprehensive coverage for people, for whether they're men or women. When we buy medical assistance policies for people, we are buying comprehensive health care for those people who can't afford it on their own. And we should not sit in judgment and decide that some poor people have access to only certain things, and people of other means or who are lucky enough to have an employer who pays for coverage have access to others. We should not be denying anyone covered by our policies access to the full range of legal, safe, and comprehensive coverage. Nor should we, in a year when you are cutting the budgets of all of our state agencies and all of our support, should we be running another test case up the legal court system when we already have a fairly definitive Minnesota Supreme Court ruling that has withstood all of these years? And we should not take away the right of women, no matter what their economic circumstances are, to take advantage of a comprehensive coverage of health insurance. I trust them, their doctors, their faith leaders, and their family to make the right choice.
The member from Anoka, Representative Whalen.
Thank you, Mr. Speaker. Just wanted to respond to a few things that I've been hearing in the debate, and in particular to Representative Lesh, the desire to speak truth, and that often on the floor we don't really hope to persuade, or we don't think we can persuade. And I completely understand your frustration, and I don't necessarily disagree. But I will say this: I hope to persuade. I do. I hope that hearts and minds are opened. I hope that people listening at home, listening in the gallery, I hope that you are persuaded, because at the end of the day, as I said before, truth doesn't change. Truth is not going to change. Abortion takes a life. And to the point that this is a religious freedom issue, my religious freedom and the religious freedom of many Minnesotans who believe that this is wrong and this violates their beliefs, it's a violation on them. It's a violation on the religious freedom of Minnesotans who are being forced to fund a practice that goes against their sincerely held religious beliefs.
The member from Hennepin, Representative Flanagan.
Thank you, Mr. Speaker. Will Representative yield for a question? Representative Franson yield for a question.
She will yield. Representative Flanagan.
I'm wondering if Representative Franson could tell us how many women on medical assistance she's spoken to regarding putting together this bill.
The member from Douglas, Representative Franson.
Thank you, Mr. Speaker. Members, this is a bill that we bring forward every year through MCCL, and that the taxpayers have asked for this bill to be put forward.
Representative Flanagan.
Thank you, Mr. Speaker. Well, thank you for answering my question, because I think that answers a lot of questions. We have a habit, and we're developing a habit, of not listening to low-income women and not listening to women of color within the legislature. When we make these decisions without the people who are directly affected by them, we're not doing our job. Thank you.
Any further discussion? The member from Douglas, Representative Franson.
Thank you, Mr. Speaker and members. You know, it saddens me that we've heard some comments how we are judging women and that we think less of women who are getting abortions. I think abortion is a very serious issue. It's a very sad issue. And when I have met women who have had abortions and spoken to them, and there is a sadness in them, there is a deep, deep loss of a child And I just want to love on those women. To be put in a position where you think that your only choice is to end the life of your baby in order to continue on with your life is extremely sad. And so when we have these conversations, I would hope that you would not say that we're passing judgment, because that's not, my faith doesn't tell me to pass judgment on women. It says to pray for them and to love on them. To love them like Jesus would love them. But we get involved with the abortion debate because taxpayers are paying for abortion. Also, science says life begins at conception. You know, when there is the meeting of the sperm with the egg, there is a flash of light, the moment of conception. And scientists have said life begins at conception. And also, abortion is not health care. It ends the heartbeat, the life of an unborn child. But this bill in front of us does not prohibit abortions. It simply states that taxpayers will no longer pay for the elective procedure, which is already prohibited in federal law. Thank you, members.
Seeing no further discussion, the clerk will take the roll on the bill. The clerk will close the roll. There being 77 ayes and 54 nays, the bill is passed and its title agreed to. The next bill on the calendar for the day is House File 812. The clerk will report the bill.
House File number 812, number 2 on the calendar for the day, an act relating to health, the second engrossment.
I recognize the member from Polk, Representative Kiel, to introduce your bill.
Thank you, Mr. Speaker and members. Our goal has always been to protect women. The language in House File 812 puts the focus on women and for their health and safety. We want abortion facilities to allow the clinical policy guidelines for abortion industry standards set by the organizations like the National Abortion Federation or Planned Parenthood accreditation guidelines. Why is this so important? You may remember the horrendous news story regarding Dr. Gosnell. I have a little snippet from his grand jury report. It speaks about NAF, National Abortion Federation. It is the Association of Abortion Providers that upholds the strictest health and legal standards for its members. Gosnell bizarrely applied the admission shortly after Ms. Munger's death. Despite his various efforts to fool her, the evaluator from NAF, readily noting that the records were not properly kept, that risks were not explained, that patients were not monitored, that equipment was not available, that anesthesia was misused. It was the worst abortion clinic she had ever inspected. Of course, she rejected Gosnell's application. She just never told anyone in authority about all the horrible, dangerous things that she had just seen. In Pennsylvania, that meant that Gosnell could continue practicing. If we pass House File 812 in Minnesota, we would be able to shut down that facility that provided the dangerous health care or the dangerous abortion. I have listened hard and heard the concerns expressed throughout the committee process. This is a bill that is both pro-choice and pro-life that members can support. We are not looking to shut down abortion facilities. We are working toward making sure that women are our priority. This bill asks that abortion industry in Minnesota to follow evidence-based clinical standards already followed by NAF and Planned Parenthood guidelines. For clinics providing 10 or more abortions, the roughly 10,000 abortions happen in Minnesota each year. More than 99% of them happen in 5 facilities that would be affected by legislation. The remaining 1% typically happen either in a licensed hospital or in a doctor's office where women go for, where women attend with an ongoing relationship with their doctors. What is different about the language that was heard and added in Ways and Means? The original bill would have required abortion facilities to follow the same licensing standards as outpatient surgical centers. Many of the outpatient surgical centers standards were building focused, with the requirements for everything from doorways to hallways to HVAC systems. The new language still requires that abortion facilities to be licensed, but the standard would be clinically based rather than facility based. Essentially, abortion facilities would have to abide by their own industry clinical standards. It is our understanding that each of the 5 abortion facilities already meet those standards in Minnesota. Why is this legislation needed? Women trust that when they walk into an abortion facility, it is already meeting the basic standards. While we have no reason to believe that Minnesota's existing abortion facilities aren't living up to this expectation, there is absolutely nothing stopping another facility from opening up that doesn't meet this standard. There are examples from other states of certain abortion facilities providing substandard care on a regular basis. We want to make certain that this never happens in Minnesota. Gosnell was denied a NAF membership, yet his facility remained open. If we pass this legislation, that won't happen in Minnesota. Thank you, Mr. Speaker.
Representative Kiel offers the following amendment. The clerk will report the amendment.
Kiel moves to amend House File Number 812, the second engrossment, and the amendment is coded A7.
Recognize the member from Polk, Representative Kiel, to introduce your amendment.
Thank you, Mr. Speaker. There was we patterned this after pregnancy centers excuse me, not pregnancy centers, birthing centers, and the number was changed a little bit. And members, we need to make it 365 instead of the 345.
Representative Dean offers the following amendment to the A7 amendment. The clerk will report the amendment.
Dean moves to amend the Kiel amendment to House File Number 812, the second engrossment, and the amendment to the amendment is coded A10.
Recognize the member from Washington, Representative Dean, to your amendment.
Thank you, Mr. Speaker and members. This amendment simply adjusts the amount spent to the SGSR account to reflect the fiscal note. It's a technical amendment.
Mr. Speaker, I rise to a point of order under Rule. Mr. Speaker, I guess I'll get recognized first.
The member from Ramsey, Representative Pinto, for what purpose do you rise?
Thank you, Mr. Speaker. Mr. Speaker, I rise to a point of order under Rule 3.21B, and I am prepared to offer advice.
State the rule again.
Mr. Speaker, it's Rule 3.21B.
State your advice, Representative Pinto.
Thank you, Mr. Speaker. As the Speaker and the body are aware, I've had some frustrations this term and last term as well, I suppose, with what has felt like inconsistent rulings regarding germaneness. Mr. Speaker, it seems to me that this secondary amendment greatly expands the scope of the primary amendment. Rule 3.21b requires that a secondary amendment relate only to the primary amendment without introducing any new subject. The underlying amendment changes the licensing fee. Chair Dean's secondary amendment, as the chair said, changes the amounts coming out of the special revenue fund. Mr. Speaker, this seems to me to be the kind of secondary amendment, the kind of amendment that previously has been found to be not germane when offered by the minority. And Mr. Speaker, I would urge you to find the point of order well taken. If, however, Mr. Speaker, you do find the point of order not well taken, Mr. Speaker, it seems to me that we get a sense, the body does, as to kind of where the strike zone is on a given day. There are two amendments that follow this one. Follow Representative Kiel's amendment, and so in the event that the Speaker does find this point of order not well taken, this secondary amendment be germane, that'll be an indication, I think, to the body as to how broad the strike zone is today and how what kind of rulings might be made on those other amendments. But in any case, Mr. Speaker, I'd urge you to find the point of order well taken.
Is there any further advice? The member from Washington, Representative Dean.
Thank you, Mr. Speaker. Offering advice to the Pinto motion on 3.21b. Actually, Mr. Speaker, this further clarifies the amendment. There's absolutely no difference in funding source. What the money is coming from or where the money is being spent, it's exactly the same. If Representative Pinto wanted to make this argument on germaneness, I would suggest another amendment perhaps, because this one just clarifies it directly to the fiscal note that we've received. It actually makes it tighter, not looser. So there's absolutely no change to the strike zone. It's an identical pitch with just a different number bearing fiscal note. So I would offer Representative Pinto the advice to check a different amendment if he wants to make that argument.
Mr. Speaker, further advice.
Representative Pinto, state your advice.
Thank you, Mr. Speaker. Mr. Speaker, Representative Kiel, when she offered the amendment, referenced simply the change in the licensing fee of the $20. If there are 5 or 6 facilities, we're talking about a difference in $100 and $120 per year. There's quite a substantial change that's proposed in the secondary amendment in terms of where the money is transferred. I understand this is consistent with a fiscal note, Mr. Speaker. Certainly this could have been offered as a primary amendment, but once this is offered as a secondary amendment, the question is, does it expand the scope of the primary amendment? And it does. And I think there could be no question when we look at it that it in fact does expand that. Thank you, Mr. Speaker.
Advice, Mr. Speaker?
The member from Sherburne, Representative Knobloch.
Mr. Speaker, rise to offer advice.
State your advice.
Mr. Speaker, the underlying amendment increases the license fee and thus increases the amount of money that's coming into the state. The amendment to the amendment then basically reflects spending that additional money by an increase in the amount of money that is being spent. So I think this is very germane to the amendment that is the underlying amendment.
Mr. Speaker, advice?
The member from Hennepin, Representative Freiberg, state your advice.
Thank you, Mr. Speaker. If you look at Section 1 of the bill, that's a modification to an existing statute, chapter of the section of the statutes, Section 145.4161. The Kiel amendment is in subdivision 7 of that. It changes what the fee is. That's certainly true. But the secondary amendment is a totally different section. It's a budgetary appropriation. As Representative Pinto mentioned, it brings in a new section. It violates It violates the requirement that amendments to amendments relate only to the primary amendments. One section changes a section of the statutes. The other section is a budget appropriation. Those are two different sections. They don't relate to each other. The secondary amendment is not germane to the underlying amendment, and you should find the Pinto point of order well taken.
Members, after reviewing the amendment to the amendment, the underlying amendment, and the bill itself, and upon the advice of numerous members, I find the point of order not well taken. Discussion on the Dean amendment, the A10 amendment. Any further discussion on that amendment? Seeing no further discussion, all those in favor of adoption of the A10 amendment signify by saying aye. Those opposed, no. The motion prevails and the amendment is adopted. We're now on the A7 Kiel amendment as amended. Discussion on the A7 Kiel amendment as amended. The member from Olmsted, Representative Liebling.
Mr. Speaker and members, I don't know whether the amendment, it's hard to discuss this amendment without discussing the fact that this was not heard, that the fiscal note was not available when the bill was in Ways and Means. And I understand that we just got a fiscal note. Personally, I haven't seen the fiscal note. Here we are on the House floor, changing appropriations, changing fees, and the members haven't seen the fiscal note, except maybe perhaps it's online. I don't have my computer with me today. But, so I just wanted to make that comment. This is a bill that changed dramatically after it went through the Health and Human Services Reform Committee. So this language that's before us today was never heard in any committee except Ways and Means, and when it was in Ways and Means, there was no fiscal note. So I just simply rise to make that comment that here we are. It seems to me that the Republican majority is very happy to bend the rules or to have no rules, or to apply whatever rules you want if you like the underlying bill. And I think that that really does a disservice. What in the heck is the hurry? What is the big rush that we couldn't have held this bill in Ways and Means to get a fiscal note so that we could at least know what was being spent, where it was coming from, and where it was going? That's my comment, Mr. Speaker.
Any further discussion on the A7 Kiel amendment as amended? Seeing no further discussion, all those in favor of adopting that amendment as amended signify by saying aye. Those opposed, no. The motion prevails and the amendment as amended is adopted. Representative Murphy E. offers the following amendment. The clerk will report the amendment.
Murphy E. moves to amend House File Number 812, the second engrossment as amended, and the amendment is coded A5.
Recognize the member from Ramsey, Representative Murphy E. to your amendment.
Thank you, Mr. Speaker and members. The amendment that I have today deals with contraception. It is a known means to prevent pregnancy. It is also a known means to prevent unwanted pregnancy and thus abortion. Mr. Speaker, I'm wondering if Representative Kiel would yield for a question.
She will yield. Representative Murphy.
Thank you, Mr. Speaker. And Representative Kiel, did you happen to bring the materials that you had in the Ways and Means Committee from the National Abortion Federation?
The member from Polk, Representative Kiel.
Yes, Mr. Speaker. Representative Murphy, yes, I did.
Representative Murphy.
Mr. Speaker, if she would yield again.
She will yield. Representative Murphy.
Thank you, Mr. Speaker. And Representative Kiel, I got a copy of it after the Ways and Means Committee because you were making multiple references to this as a means for accreditation. What your bill requires, of course, is clinics be accredited, and one of the means to that is the National Abortion Federation. So I have a copy of that document here as well. And I'm wondering if you've read through it and if you've looked at the information at the top of page 49.
Representative Kiel.
Mr. Speaker, Representative Murphy, yes, in fact, I have.
Representative Murphy.
Thank you, Mr. Speaker, and thank you, Representative Kiel. And so, because this is one of the two bodies that you would expect clinics that perform abortions to be accredited by. When I look at this document, I don't think it's about accreditation, but instead certification, but you are using this as a means to seek accreditation, and that we would ask our clinics to follow this. If members look at this document themselves, they would see at the top of page 49 a standard of care for patients be provided in those clinics dealing with contraception. Appropriate and accessible post-procedure and follow-up care is essential to patients' well-being. Contraception must be discussed, and then it enumerates recommendations in which contraception must be offered. So if we're going to ask abortion clinics to abide by this document as a standard of accreditation, then I believe that it is important that we pass this amendment, and I expect, Representative Kiel, you're going to support this amendment that offers contraception to women that is affordable and accessible. Members, the amendment that I have before us today just says that health insurance companies that provide prescription drug coverage must also cover all FDA-approved means of contraception, and they must do that for 12 months. If we're going to require that abortion clinics abide by this standard of accreditation, then I think it only goes to say that we should assure that women have access to affordable and accessible contraception, and therefore I ask for your vote for my amendment. Thank you.
Mr. Speaker?
And Mr. Speaker?
Representative O'Neill, for what purpose do you rise?
I have a point of order, Mr. Speaker.
State your point of order.
Mr. Speaker, I rise to a point of order. Under House Rule 3.21, motions must be germane. I'm prepared to offer advice.
State the rule again.
Mr. Speaker, 3.21, motions must be germane.
And state your advice, Representative O'Neill.
Thank you, Mr. Speaker. Mr. Speaker, this amendment falls under Chapter 62Q, but the bill itself falls under Chapter 145. The legislation is about licensure of facilities where abortions are performed, but not about prescription pharmaceutical coverage. And with that, I'd ask for you to rule in favor of my motion.
Representative Pinto.
Mr. Speaker, Mr. Speaker, advice.
State your advice.
Thank you, Mr. Speaker. Mr. Speaker, members, so here we are. We just had the exchange between Representative Murphy and Representative Kiel and Mr. Speaker indicating that part of the accreditation process, Mr. Speaker, is it requires these, or has these national organizations saying that prescription coverage is part of, and prescription and contraception, pardon me, is part of the process of accreditation. This, Mr. Speaker, is simply, we just had in the last exchange about a clarification of the underlying amendment. This amendment is a clarification of the underlying bill. And the question is, will we have a full and robust debate? So, Mr. Speaker, we have a sense from your past ruling that the strike zone allows these kinds of clarifications to be brought in. Mr. Speaker, I would urge you to find the point of order not well taken, consistent with the ruling that you made just a few minutes prior.
Members, after reviewing the bill and the amendment and the rule, I find the point of order well taken.
Mr. Speaker?
Representative Murphy, for what purpose do you rise?
Thank you, Mr. Speaker. I'd request an appeal of the rule of the Speaker, and I'd ask for a roll call, please.
Representative Murphy moves to appeal the ruling of the Speaker and requests a roll call. Seeing 15 hands, there will be a roll call. Member, as a reminder, the question before the body under this motion is, shall the decision of the Speaker stand as the judgment of the House? A yes or green vote supports the ruling of the Speaker. A no or red vote goes against the ruling of the Speaker. Further discussion on the motion. The member from Ramsey, Representative Murphy.
Thank you, Mr. Speaker and members. I will reiterate the point of Representative Pinto advice. Representative Kiel made a strong argument in committee about accreditation. She referred to 2 points, 2 organizations that do that accreditation. That accreditation, that certification requires treatment with contraception. I know you can cite areas of law, as Representative O'Neill did, but in making that argument, you're hiding behind citations and not recognizing what it is that you're actually doing and saying to women and to the providers. Members, it is so obvious to me what we're up to with this piece of legislation. And I know you don't want to take this vote. I'll just leave it at that. Thank you.
Seeing no further, let me just repeat the question and then we'll take the vote. The question before the body is, shall the decision of the Speaker stand as the judgment of the House? A yes or green vote supports the ruling of the Speaker. A no or red vote goes against the ruling of the Speaker. Seeing no further discussion, the clerk will take the roll on the question. The clerk will close the roll. There being 78 ayes and 53 nays, it is the judgment of the House that the decision of the Speaker shall stand. Representative Halverson offers the following amendment. The clerk will report the amendment.
Halverson moves to amend House File Number 812, the second engrossment as amended, and the amendment is coded A6.
I recognize the member from Dakota, Representative Halverson, to your amendment.
Thank you, Mr. Speaker. And this amendment seeks to underscore the need to provide science-based health care. It does a couple of things. One, it ensures that it is in statute that patients are provided evidence-based medicine and that physicians are providing care that is appropriate to the patient based on the physician's judgment. We want to let our providers serve their profession with integrity and without the dictates of the state legislature. Several years ago, some laws were passed and put on the books that actually put into Minnesota state statute medically inaccurate information that is required to be shared with women. And let's be honest, just with women. For some reason, we single out health care that women received for special legislative interference and analysis. Now, nobody in this legislature should be practicing medicine as part of our job. That is the job of physicians. And when we heard the original bill in committee, in fact, physicians testified that this legislation is onerous and unneeded. I'm not sure if there has been further exploration with regard to what the medical community actually feels like they need from the legislature to make sure that they're able to serve their patients well. But after we passed, or the legislature passed laws stating that physicians were required by law to give women medically inaccurate information, that women didn't have proper judgment to seek health care in a timely manner, so we had to make them wait to get their procedure because for some reason women are not to be trusted in getting a procedure, in getting informed consent, which is part of health care and is actually part of our state's Patient's Bill of Rights, in absorbing that information and in having a procedure, that somehow women are less capable than other patients in the healthcare system. That's not true. Women know what they're doing when they go to seek abortion services. They do their research. Many women, in fact, most women who have abortion procedures have had children before, so they know what a pregnancy means for them. They know what raising a child means for them. And they seek abortion procedures for reasons too numerous to account for. But their reasons are their reasons. If it has to do with the health of the mother, if it has to do with the health of the fetus, the viability of the fetus, if it has to do with her ability to care for a child, if it has to do with her faith, whatever it is, women, it's the business of women. It's not the business of the state legislature. And so for the state legislature to get involved and start dictating to physicians what to do is troubling. Those laws are on the books. We need to get rid of them. We need to trust physicians to do their job. We've got the Board of Medical Health in Minnesota that oversees physician practice. We have organizations like the Dental Association, and we have organizations like the American Association for Psychiatry. We've got numerous professional organizations that provide physicians with the standards of care for their practice. And we have organizations like the University of Minnesota Medical School that trains physicians in Minnesota to provide appropriate, adequate, and evidence-based care for their patients. And for some reason, the legislature keeps coming up with ways to try to dictate the relationship between a patient and their doctor. And so my amendment is here to stand up for science, as millions of people did around the country this weekend, to say that we're going to trust our board-certified physicians to have relationship with their patients. We're going to trust that the laws we put in place around the Patient's Bill of Rights, which gives people the ability to know who their provider is. For some reason, there's a lot of accusation that women don't know that their abortion providers are shrouded in mystery and they're never going to know who they're seeking care from. That actually is already state law. It's part of Minnesota's Patient's Bill of Rights. And so we're going to take a stand today to stand up for women's health care and access to health care based on science, based on evidence, and based on the expert judgment of physicians and the smart research of their patients. So I would encourage you all to support this amendment. Thank you.
Mr. Speaker.
Representative O'Neill, for what purpose do you rise?
Mr. Speaker, I have a point of order.
State your point of order.
Thank you, Mr. Speaker. Under House Rules 3.21, motions and propositions must be germane, and I'm prepared to offer advice.
State your advice.
Thank you, Mr. Speaker. The bill before us is about licensure of facilities where abortions are performed. But, Mr. Speaker, the A6 Amendment greatly expands the scope of this bill, and it actually aims to accomplish an entirely different purpose by repealing Minnesota law on women's right to know the medical risks associated with an abortion and its alternatives. And with that, Mr. Speaker, I ask you to find my point of order well taken.
Mr. Speaker, advice.
State your advice, Representative Freiberg.
Thank you, Mr. Speaker. This amendment should be found germane for many reasons. I'm prepared to discuss just a couple of them. First of all, both the amendment and the underlying bill deal with the same chapter of Minnesota statutes, Chapter 145. But beyond that, Representative Halverson explained the need for this greatly. This requires health care to be science-based. The bill basically gives broad authority to the Commissioner of Health to adopt regulations regulating these types of facilities, and there's not much in the way of standards there. You could have very different standards depending on who the Commissioner of Health is. I happen to think we have a great Commissioner of Health right now with a very strong, very solid training in public health, one of the strongest public health commissioners we've ever had. But we don't know that there will be that level of assurance that future health commissioners will do that. So I think this provides some much needed guidance around the licensing provisions in this. It deals with the same chapter of law. I think it's totally relevant. I think it not only is it relevant, I think it's needed. I encourage you to find the point of order not well taken so that we can get on to discussing this really important amendment that Representative Halverson has offered.
Mr. Speaker, advice.
Representative Halverson, state your advice.
Thank you, Mr. Speaker. This amendment is absolutely germane to the topic at hand, particularly when we listen to the words that the bill author put forward in bringing this bill up, and that is her concern for the health, welfare, and safety of patients in Minnesota. And relevant to the health, welfare, and safety of the patients in Minnesota is making sure that our state empowers physicians to meet the standard of evidence-based medicine in Minnesota. And that's for all patients in Minnesota. The fact is that the Patient's Bill of Rights addresses what the women's right, part of the Women's Right to Know Act seeks to put forward. And the fact is this is also a part of the standard for accreditation that is being advocated for by Representative Kiel. And so for those reasons, it is perfectly germane to this bill, and I ask for the point of order to be found not well taken.
Members, after reviewing the rule, the amendment and the underlying bill, and actually getting a statute book out and looking at the statutes, I find the point of order well taken.
Mr. Speaker.
Representative Halverson, for what purpose do you rise?
I rise to appeal the ruling of the chair, and I ask for a roll call.
Representative Halverson moves to appeal the ruling of the Speaker and requests a roll call. Seeing 15 hands, there will be a roll call. As a reminder, members, the question before the body under this motion is, shall the decision of the Speaker stand as the judgment of the House? A yes or green vote supports the ruling of the Speaker. A no or red vote goes against the ruling of the Speaker. Discussion on that motion. The member from Dakota, Representative Halverson.
Thank you, Mr. Speaker. Well, once again, I'm disappointed with a ruling from the Speaker's chair. It's disappointing to me that we can't have a real discussion and let Minnesotans really hear what members think about these provisions. I'm not afraid to let folks know that I think that we need to be on the side of science when it comes to healthcare in Minnesota. And I want folks to know that I understand that women in Minnesota have the ability to make decisions, smart decisions, about their own healthcare needs in consultation with their board-certified physicians. That women don't need the state of Minnesota, most certainly no one in this body, to interfere with that relationship, and yet that is what we're doing. And to say that this is just a procedural hiccup, that's why we're not discussing this, just really feels unfortunate to me. Because the fact is the women of Minnesota should be able to know who is standing up for them And the women of Minnesota deserve to know if we care about the actual science that goes into the care that they receive. There's been a lot of talk about emotion and a lot of talk about faith and a lot of talk about all those other things that go into this decision making, which I trust women to do. But here we are discussing the basic science and saying that we're going to stand up as a body and support physicians to have the integrity to practice medicine the way they were trained to do, that they have the integrity to build relationships with their patients like they were trained to do. And we as a legislative body are going to stand on the side of science. But instead, we're going to hide behind a procedural vote so that we don't have to have that discussion about whether or not science is real in the state of Minnesota. There's actually a children's album called Science is Real by They Might Be Giants. You should check it out. It's pretty awesome. My kid loved it growing up. Learned a lot about the elements and the human body and all kinds of things that we know because of science. And today we're being told that we don't get to discuss whether or not science-based medicine, evidence-based medicine is going to be part of the pantheon of care that our Minnesota patients receive. That's just wrong. And it's germane to the bill. It's part of this accreditation process that's being advocated for. If you really are advocating for patient safety, if you're really advocating for accreditation by national organizations, then it's time to listen to doctors. It's time to listen to women. It's time to get out of our own echo chamber and understand that the folks that are out there providing care are doing it with the greatest level of integrity, and they're under the watchful eyes of their state licensing boards. They're under the watchful eyes of their peers. They're under the watchful eyes of their professors. The fact that the legislature feels the need to practice medicine should frighten all Minnesota patients. It certainly troubles me. Members, please vote to overrule the chair. Thank you.
Discussion on the motion to appeal the ruling of the Speaker. The member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker and members. Well, members, this has to be germane to this bill, and I'll tell you why. Because if this amendment is not germane to this bill, then the underlying bill is a complete farce. A complete farce, because what the underlying bill purports to do is have abortion providers be accredited by a national organization that establishes evidence-based clinical standards for abortion care. Evidence-based standards. Well, what we have in law right now is not evidence-based. And all that this amendment does is put evidence-based into the bill and repeal some of the provisions that are not evidence-based. So, if you were to pass this law, this bill 812 without the amendment, and it was to become law, that would create a very odd situation where you would be telling physicians in law to do certain things in their practice while they had to be accredited by an organization that has to use evidence-based and is measuring them according to that standard. Now, maybe that's your purpose in passing this bill, to put abortion providers in an impossible situation. Maybe that is your purpose. And so I guess you're going to want to uphold the ruling of the Speaker. But if this bill has any serious intent, as the author says she's really trying to find some common ground. She's seriously trying to protect women. Well, if any of you are seriously trying to protect women, and that is the purpose of the bill, then this is absolutely an amendment that is germane, and you should overrule the Speaker.
Member from Hennepin, Representative Pepin.
Advice to the body. I would just say that this trying to over appeal the ruling of the Speaker is ridiculous. If you look at what the amendment, we've heard a lot about what the amendment is, the amendment. But what we haven't heard is about the repeal language. And what the whole point of the repeal language is to take the right away from women to get information that they've had. And we hear a lot about women and protecting women, but what this amendment is getting at is to take information, important information that women need to make informed choices. That is what the amendment is trying to do. Whereas the amendment is not trying to do that at all. What we're trying to do in the bill is we're trying to protect women by making sure that these facilities are licensed. So we've heard a lot of speeches today about how we need to protect women. That's how we need to protect women, by making sure when they go into these facilities that they're going into facilities that are actually licensed. And all this amendment is trying to do is take away a woman's ability to get information that she needs to know to make an informed decision. It's not germane. It greatly expands what the bill is trying to do. And members, we should agree with the ruling of the Speaker and vote green on this.
The member from Blue Earth, Representative Considine. Any further discussion on the motion to appeal the ruling of the Speaker? One last time before we move to a vote, the question before the body is, shall the decision of the Speaker stand as the judgment of the House? A yes or green vote supports the ruling of the Speaker. A no or red vote goes against the ruling of the Speaker. The clerk will take the roll on the motion. The clerk will close the roll. There being 78 ayes and 53 nays, it is the judgment of the House that the decision of the Speaker shall stand. There are no further amendments at the desk. The clerk will give the bill its third reading.
Third reading, House File Number 812, as amended.
Third reading. Discussion on House File 812 as amended. The member from Hennepin, Representative Hornstein.
Thank you, Mr. Speaker and members. I think this last discussion was extremely important, and I want to amplify a couple of the points. That's why I passed out a letter from the Minnesota section of the American Congress of Obstetricians and Gynecologists. This is near and dear to my heart, members, because my father of blessed memory was an obstetrician gynecologist. My older brother is an obstetrician gynecologist. He runs the in vitro fertilization clinic at Brigham and Women's Hospital in Boston. So I didn't go into the family business, but I do very deeply respect, as Representative Halverson said, the integrity of the medical profession, the incredibly extensive training they receive, their expertise, their skills, and above all, their deep commitment to the wellness and welfare of their patients. And so I believe strongly in the sanctity of the doctor-patient relationship. And so I want to just read to the body and to the public one line in this letter from the obstetricians and gynecologists, which I think summarizes very clearly my concerns, I think the concerns of many with this bill. So the obstetricians and gynecologists write towards the end of their letter to us, it seems very clear then that this legislation is not about safety. It is a targeted attempt to restrict a safe and legal and safe health care option for women in Minnesota by introducing unsubstantiated and unnecessary requirements for certain facilities that provide abortions. That's the gist of this issue. That's the gist of this bill, and that's why I'm voting no.
The member from Olmsted, Representative Liebling.
Mr. Speaker and members, So when Representative Pepin spoke, I thought perhaps she was reading the old version of the bill and not the current version. Members, this is a very different bill than it was when it was heard previously, all the times it was heard previously. And I believe that this bill is, well, the author has said that she genuinely wants to make sure that women having abortions are safe. She said that a number of times. She talked in the Ways and Means Committee, the only committee where this bill had a hearing in its current form. She talked about a concern, I think she said it on the House floor too, that there is no doctor-patient relationship when women are getting an abortion. Well, that isn't true. Of course that isn't true. There is, and of course it's also true that in many situations women might see a healthcare provider once and not again or twice. That doesn't mean there's no doctor-patient relationship, and we know that healthcare providers are under certain requirements based on their own license. So, you know, of course there's a doctor-patient relationship, but if we take the author at her word that she's interested in safety and that this is some kind of a bill that's meant to find common ground, well, you know, I could see that there might be a seed of that in this bill, a seed of it. And that is because Representative Kiel has referred to this document that she brought a copy of it today, and I have a copy of it too, this Clinical Policy Guidelines for Abortion Care from the National Abortion Federation. And in fact, these are guidelines that a lot of abortion clinics follow already. And you know, I think there could be a path forward there because what's in this document is evidence-based. Evidence-based. But that's not what this bill is about. Because this bill doesn't refer to any particular organization. This bill is full of holes. This bill is a message bill. It doesn't specify which national organization. And it has a lot of other things in it too that are just really very vague and need to be fleshed out. And as I read this bill, what I really see in it is that it is yet another attempt, or could be another attempt, to target abortion providers, to make public their names, along with the names of other people who work at abortion facilities, and to impose very heavy burdens on abortion clinics, possibly because there are things in here like that the Department of Health can ask for other information that they deem appropriate, other information the commissioner deems necessary, and all kinds of other issues that are in the bill. And of course, perhaps if the author was really sincere or is sincere, perhaps some of these things could be worked out, but not in the Ways and Means Committee. So the whole process that this bill has traveled this year makes me think that the real purpose behind this bill is just to have another legal test, if the governor would sign it, which I doubt very much that he will, but if he would, that this would be challenged in the courts and that we would see if the Supreme Court case of Whole Women's Health is still applies to this too, like it does to the underlying bill that is no longer before us. So I think that this bill, you know, the idea that abortion clinics should follow evidence-based guidelines, great, they should. Absolutely they should. Women should get the best possible care. We all want that. We all want, I think we all want abortion to be safe. A lot of us want it to be legal, and all of us probably want it to be rare. But safe for sure, Representative Kiel, absolutely. But that's not what this bill does. This bill is full of holes. It didn't follow the proper path through committees. There wasn't a real opportunity to discuss a lot of the items in here. The fiscal note, which Representative Knobloch just emailed to me, just came out this afternoon. Didn't even get that heard in the Ways and Means Committee. So come on, members, this isn't serious. This is just, you know, let's all just salute our favorite point here. We're just all going to salute which side of this debate we're on. It does nothing to move us forward, and that is really too bad, because I think if safety for women is really, really what we're concerned about, there might be a way to get there, but this bill sure is not that way. Thank you.
The member from Washington, Representative Lomer.
Thank you, Mr. Speaker and members. And I want to thank you, especially Representative Kiel, for bringing this bill forward. This is an extremely important initiative. I really can't imagine any of you on the other side of the aisle not voting for this bill. Because with this bill, we are asking the state of Minnesota to assure that women in the state who choose to have an abortion are safe, that they're being treated by licensed physicians, cared for by nurses who are also licensed, with equipment that's been properly cleaned and sterilized, that emergency provisions are in place so that if the unforeseen circumstances, such as an uncontrolled bleeding or other life-threatening situation should arise, there would be care for them. You know, we've talked about this before in committee. We've talked about that we have licensing requirements for tattoo parlors and barber shops. 25 states require licensing and inspecting and regulations of abortion clinics. And I've been doing some research, and where I started was at the DHS and the MDH websites to check all the licensing requirements for people who do business in Minnesota. And on the top of the page on DHS for licensing, it says this: DHS licenses service providers and monitors and investigates their compliance with Minnesota laws and rules. Licensing protects the health, safety, and rights of those services by requiring that providers meet minimum standards of care and physical environment. So I actually wrote them all down. I have 8 pages, and I could actually read them all. I don't think I will, but I'm going to go through some of the areas that we license in the state of Minnesota. From home management, housing with service establishments, uniform consumer information guide, boarding care home, nursing homes, supervised living facilities, birth centers, hospice, hospital and critical access hospitals, outpatient surgical centers. And this is where it gets really fun, the A through Z. Abstractors, accountants, acupuncture, adjusters, adoptions, adult care, adult day centers, advertising. I'm going to skip around a little bit. Animals, apiaries, apprenticeships, aquaculture, aquatic plants, archaeological fieldwork, asbestos, assessors, athletes, athletic trainers, attorneys, audiology, aviation, bed and breakfast, beer, billboards, bingo, board and lodging, brokers, business, camps and campground, card playing, catering, cats, dogs, certified public accountants, chemical dependency, chiropractors, cooling, fuel burning, and refrigeration equipment, cosmetology, counselors, dairy, driver's medical waivers, driver's license, drugs, and I'm skipping a lot. You can look these up yourself and you can see how many I'm skipping. Electricians, elevators, employees leasing companies, employment, energy facilities, explosives, family therapy, feedlots, fertilizers, my very favorite, frogs, fuels, funeral establishments, fur, gambling, game farm, healthcare providers, home health care, home management services, horse racing, horseback riding, hospitals, hotels, skipping down, law enforcement, lead workers, liming material, liquor, livestock, living assistants, martial arts. Remember I said there's 8 pages here, I'm skipping. Midwifery, minerals, money transfers, notary publics, nurseries, nursing home administrators, nutritionists, occupational therapy, pawnbrokers, payroll services, pesticides, pharmacists, pipe fitters, plumbers, public swimming pools, radiation, respiratory therapists, safe deposit companies, schools, screening, security, social work, state parks, teachers in education, telemedicine, telephone services, tobacco, tunnels, turtles and tortoises, waste, water appropriation, water conditioning, water quality, workers' compensation. So it's really obvious to me that we take licensing and inspection very seriously in this state from this list. So the question then becomes, why would we not want to do the same for abortion clinics in our state? The mantra of safe and legal is always discussed when we talk about abortion rights. However, it's apparent that this is not found to be safe and legal in the states where licensing and inspections are happening. So yesterday afternoon, I spent quite a bit of time. I just Googled abortion clinic issues. And you should do that, and you'll be pretty depressed when you do, because you will read many disturbing stories from states around the country. Members, we don't live in a third world country. We live in the United States of America. You would expect that women in our country who go in for abortion would be safe, but it has not been the case. So here's just a few examples of what I found. A former abortion clinic which was purchased in Kansas. This was a quote from the person who purchased this former abortion clinic. There was mold and general filth. The carpets outside the abortion room were stained with blood. The ceiling nearby was broken. All the walls were covered with cheap contact paper instead of being properly maintained. The entire area had the stench of death. Under the sink was the biggest garbage disposal I've ever seen. It was under the sink where the suction machine bottles were washed. California had several examples. One clinic had a cease and desist order. They were operating illegally because they were having challenges getting doctors who were actually licensed to perform abortions. And the one who was practicing there had 9 malpractice claims against him. Birmingham, Alabama. There was counseling that was done from non-licensed staff. They hadn't updated policies and procedures since 1996. They did not have a required infection control committee and did not investigate potential infections. On inspection, they did find violations, including an administrator that was ordering and diverting narcotics for her own personal use. That administrator was a licensed practical nurse whose license had been revoked for drug abuse. No pregnancy tests were performed. No ultrasounds were done. RU 486 was being administered without a doctor. Florida, New Jersey, Detroit, Massachusetts, they all had similar stories. I encourage you to look it up. So in Minnesota, Planned Parenthood has increased its operations of aborting babies to up to 23 weeks, 6 days. And members, I believe that that should require an outpatient surgery center status. But that's not what we're asking for here. How do we know? How are we supposed to know that these clinics are following the laws that we have in this state? We have laws for fetal remains to be given a dignified burial. That is a law in our state. But how do we know if that's happening? Now, the videos were talked about last year, and that got people kind of riled up. But they actually happened. They were actually undercover videos. Amy Miller, who is the owner of the Whole Woman's Abortion Clinic in downtown Minneapolis, was on the tape saying that you can procure fetal tissue in Minnesota. And if anyone doubts that and doesn't believe me, I have it on my computer, and I'm happy to send it to you. You can hear her say that. According to the report from the Minnesota Department of Health from 2015, I'm changing subjects now, there were 9,861 abortions performed, nearly 10,000. Does it not seem prudent and right to have inspections to assure that these women are getting good care? The largest age group was the 20 to 24-year-olds. That was 2,939. There were actually 18 girls under the age of 15. And just for the representatives, maybe from Hennepin County, I thought it would be interesting to know there were 3,312, Ramsey County 1,627. These are all women that you should be caring about. These are in abortion clinics in our state, and we need to know that they're safe. So I don't know, members, what we're afraid of. You know, we talk about watchful eyes. Whose watchful eyes? Nobody's inspecting these clinics. I mean, the doctor that testified in our committee was asked the question if he felt comfortable getting his hair cut in a barber shop that wasn't inspected, and he couldn't answer the question. So I think, members, this is a very reasonable, important bill to pass, and I really feel like the governor will sign this bill. If he cares about women, he should sign this bill. So I thank you very much, and I hope you will vote green.
The member from Anoka, Representative Scott.
Thank you, Mr. Speaker. It was described as filthy and disgusting. There was blood on the floor. There were flea-infested cats roaming the clinic. You walked in the clinic and the walls appeared to be urine splattered, and there was a stench of urine in the air. The procedure table had a ripped plastic cover. The suction tubing was used for abortion procedures and doubled as the only available suction source for resuscitation, and it was corroded. Members, these were the conditions found in Dr. Gosnell's clinic, and not that much different than the examples that Representative Lomer just gave us. Now, we've had a lot of discussion here about abortion and is it health care, and I will tell you folks, I don't think any woman in the state of Minnesota should have to risk walking through a clinic that might have even one of these conditions. And we shouldn't expect that, you know, men and women in this chamber, we have daughters, a lot of us have daughters. Would you want your daughter risk walking through a clinic with these kind of conditions? That is a risk to their health. This is a very common sense bill. Maybe everybody's minds are already made up. But to me, this is, as Representative Lomer said, one of the most common sense things that we can do to protect women's health. And we can't just say that this will never happen in the state of Minnesota. We don't know that. It's happened in many other states, and we don't know if it's happening here or not, because there's nothing structured to make sure that this isn't happening. These standards were the standards that the abortion industry came up with for themselves. Why would you be against enforcing that? Members, I encourage a green vote on this bill. It's one of the best votes you're going to take this year for common sense. And I think the people of Minnesota that are watching this debate would agree with that. Vote green, folks. Thank you.
The member from Dakota, Representative Mason.
Thank you, Mr. Speaker. Members, I wasn't prepared to filibuster, but I might reconsider. In my opinion, you have to have a very vivid imagination to believe that this bill is just about saving women. If it was about safety, wouldn't it have other procedures involved? Again, to me, this is another attack on women. Pure and simple, it's a way to limit health care for women. Let's treat the women of Minnesota with the dignity, the respect that they deserve, and please vote no on this bill.
The member from Ramsey, Representative Murphy E.
Thank you, Mr. Speaker and members. I understand that there are members in this body who believe that this is a common sense piece of legislation that's necessary to ensure the safety of women. I believe that we have a licensure scheme in place, licensing medical providers, doctors, and nurses in clinics. That is the way that in these clinics we're assuring that individuals are getting good care from skilled providers. And we've had that debate over and over again here in the committees, in the Ways and Means Committee, and now here on the floor of the House. And I've heard good examples of things that I would not want to see happen here in Minnesota, but I believe that we have, so for the people who are listening, we have regulation in place to assure the safety of people getting care in clinics across the state of Minnesota. And just because we don't know what's happening, that's the argument that people are making, we should send in inspectors. I would say we could do the same thing for every Minnesotan in their home. If that's really the standard, we don't know what's happening, should we inspect? I don't think Minnesotans would like that very much, but that's the argument that you're making this afternoon. I don't think that holds water. I have faith in our nurses and our doctors, and in fact, in Minnesotans. The concern that I have about this legislation, and as I've heard people make good faith arguments that this is a common sense piece of legislation, I am concerned with the broad authority that this legislation gives to a commissioner of health. And when I look at page 3, subdivision 6, the ability to suspend or revoke or refuse to renew a license, given that broad authority to a commissioner of health. And when I look at the clauses under which that commissioner could do that work, one of the conditions under which a commissioner could choose to close a clinic would be this: conduct or practices detrimental to the welfare of a patient. In committee and on this floor, we have heard members of this legislature testify that they believe abortion itself is detrimental to the welfare of a woman. Representative Franson made that statement. Representative Lomer made that statement. And if a commissioner of health were appointed that shared that same political point of view, then in that person's political judgment, they could apply this standard by itself and close clinics. And I think that is the underlying aim of this piece of legislation. If those of you who are seriously wanting to make sure women are getting safe care, and you don't have faith in the regulatory scheme in place right now, you don't have faith in the licensure of registered nurses, licensed practical nurses, and physicians, their ability to conduct the care that they are licensed to do so. If you don't have faith in that, and you think you need another level of regulation, then you should pursue that, but not like this. Because we know all too well that this political debate has invaded not only the political debate here, but the judgment of people who have authority. And we saw it. We saw it already in Minnesota when a commissioner was applying junk science about a connection between breast cancer and abortion, and using that to say to women, you could get breast cancer if you have an abortion. A commissioner of health. That's why I'm opposed to this. I'm opposed to this for many reasons, but that giant loophole in this piece of legislation is going to set up women and clinics and limit their options. Earlier today, there was a woman who came and gave testimony at our press conference, and she found out when she was 18 weeks pregnant that she had a baby with anencephaly, incompatible with life. And she chose to have an abortion. That was her choice, safe and legal. She made that difficult decision for herself, with her physician, with her husband, with her family. Can you imagine what the rest of that experience would have been for her if she had not had that choice? That safe and legal choice. And that's what's really on the table today for debate. As much as you're saying you want to provide safe care for women, I disagree. There's a motive behind this action, and that's why we should vote no.
The member from Roseau, Representative Fabian.
Thank you, Mr. Speaker and members. Representative Kiel, thank you for bringing this bill forward. We've heard a lot about the reasons for bringing this bill forward and what it means to women. I am concerned about the health and safety and welfare of women. In this bill, when we have the inspections and the accreditation or the certification, whatever, we're talking about the woman who is considering or doing the abortion, but I have several friends and relatives who are nurses, LPNs, RNs, and so forth, people that work in healthcare facilities. In a facility like this and what you're proposing to do, will this also help to protect the welfare, the health, and safety of the employees that work at a facility like this?
She will yield. Representative Kiel.
Thank you, Mr. Speaker, Representative Fabian. Members, yes, if it's accredited, then it will protect all of the staff that is there because they will be following the standards within the accreditation or the membership. And so they will have that to lean back on should there be an accusation or a question or concern regarding a procedure.
The member from Dakota, Representative Halverson.
Thank you, Mr. Speaker. Well, it troubles me to hear about what an easy common sense vote this is, particularly on a bill that has been brought forward to the House floor that is in no way representative of what went through the committee process. So we didn't hear any testimony in committee regarding how this is going to affect Minnesota patients, how it's going to affect Minnesota caregivers. We weren't able to ask the questions to get clarity on some of the charges that have been leveled here, that somehow all clinics in Minnesota that provide care to men and women are safe and don't need any special regulation. But clinics that provide abortion services are a complete Wild West of healthcare. We know, as the committee that provides oversight to our healthcare system, that that's not true. We're talking about licensed medical professionals who have to answer to a standard of care through their licensing process, who have to answer to a standard of care via Minnesota state law through our Patient's Bill of Rights, and who have to answer to a standard of care to their patients. And there were some folks in committee that said, well, women aren't going to complain about an abortion provider because they're too ashamed and embarrassed to say that out loud. Well, thanks to the women today who came forward to testify about their experiences in Minnesota's abortion clinics, that they have had services for a variety of reasons and have gotten good care. And they got medically accurate information from their providers. And based on Minnesota's laws, they knew who their provider was, in spite of the charges that are being leveled against board-certified physicians in Minnesota. They knew where to go for that health care, and they knew what they were doing. There's been accusations that women are just too darn emotional to make these decisions for themselves, and that's just not true. And it frustrates me that under the guise of protecting women, that we really aren't looking at this with any kind of objective healthcare lens. Why is it only the women of Minnesota that deserve this protection? There's all kinds of in-clinic procedures that are performed in facilities that aren't licensed. There are licensed surgical centers in the state that do certain procedures, but there's hundreds of procedures that get performed in a physician's office. Might be a mole removal, a tooth extraction. There's all kinds of procedures. But in this bill, one procedure in particular is being singled out. And it is a procedure that has been proven time and time again in the state of Minnesota to be one of the lowest risk, safest medical procedures that people can experience. And study after study bears that out. But here's the facts. if you are a woman and you choose to have an abortion in the state of Minnesota, you're going to go to a clinic that is operated by board-certified physicians that are going to have on staff licensed nurses, licensed counselors. For your concern about the fact that licensing is not providing oversight to this procedure, you're absolutely wrong. But we're told to overlook that somehow people who are providing this kind of health care have some sort of nefarious reason. It's not true. That they need some kind of special oversight. That's not true. If this really is about patient safety, then unlicensed clinics in general should be part of the discussion. But this isn't about patient safety. This is about abortion, singling out abortion, making sure that people are hearing wild claims about risk that aren't true, making sure that the people of Minnesota are being told that somehow women who seek this procedure deserve to be singled out for special kind of oversight in spite of their constitutional right to privacy. And Representative Murphy is absolutely right. For a bill that claims to be about patient safety, it gives unprecedented authority to a commissioner to close down one specific kind of healthcare facility. It doesn't give them authority to oversee and close down any healthcare clinic that they deem is not doing the job. Just one kind. We're going to single that one out. And we know, unfortunately, that politics plays into abortion all the time. And that's why we've seen laws, and that's why this particular underlying bill was put forward, to make sure that women have as hard a time as possible accessing safe and legal abortion in the state of Minnesota and around the country. And that's been the effect. So much so that the Supreme Court has said, you can't do that. The Supreme Court of the United States has said, you can't create an undue burden for the women of this country when it comes to their personal medical private information and their personal private medical decision making. But these laws keep coming forward, and in all honesty, because this wasn't vetted in committee, I can't say that this is the worst of the worst. I can't say what the outcome is really going to be because we never got the testimony, but I will tell you, when we're targeting abortion and we're targeting care for the women of Minnesota, you can bet that I am suspicious and I'm concerned because the goal has been stated repeatedly. It's not about patient safety. It's making sure that people don't have abortions because people don't agree that women should have access to abortion. And that's fine. You don't have to agree that women should have that choice available to them, personally. You don't have to say to your kids that you support abortion. You can go to church and you can make decisions for yourself and your family based on your faith. That is perfectly fine. But under the law of the land, women should not be treated differently in healthcare situations. Under the law of the land, women have the right to privacy when they make their own healthcare decisions. And under the law of the land, anytime a legislature decides to put itself between a woman and her physician, the legislature better have darn good reason and better not get in the way of a woman's ability to exercise her constitutional rights. That's the standard. And I'm afraid that with this bill, once again, we're going to fail in that standard. So I'm not going to be supporting it at this point. I do want to say, however, for everyone in this body and for the author, that these discussions cause a lot of us a lot of heartache on both sides of the aisle and on both sides of this issue. It's not always a partisan issue. But we need to be thoughtful about the way that we exercise our power as lawmakers in that regard. And we need to put forward thoughtful laws. And I do believe, and I think the people of Minnesota deserve us to get together and think about what our goals really are and be transparent about that. What are policy goals around healthcare safety, about a woman's right to abortion that has been upheld by the Supreme Court? And perhaps, if the goal is to make sure that we reduce the number of abortions in Minnesota, which have been declining, that we can find ways to work together using evidence-based practices to help prevent unwanted pregnancies in the first place. Those things are education, contraceptive availability. We know the policies that are out there that could support the end goal of reducing the number of abortions in Minnesota. This won't do it. This will create one more constitutional barrier for the women of Minnesota, and our constituents deserve better. Please vote no.
The member from Hennepin, Representative Carlson L.
Yeah, Mr. Speaker, members, in part of the earlier discussion, I was left with the impression that if we followed these national standards that a physician would be required to perform an abortion. And back in 1973, I was appointed to the Health and Human Services Committee and chaired a subcommittee that dealt with many health care issues, but abortion was one of them because January 22nd, 1973 is when Roe versus Wade was ruled upon. And the point I wanted to make was that there was one issue, as you can imagine, it was hotly debated at the time, where everybody was in agreement, both sides of the issue. And if you were to take a look at Statute 145.4112, dealing with the requirements, it shall be unlawful to willfully perform an abortion unless the abortion is performed by a physician licensed to practice medicine under Chapter 147 or a physician in training under the direct supervision of a licensed physician. I just wanted to clarify that because I was sitting here thinking, by golly, I remember when we passed that law because I was quite involved with trying to bring both sides together on a number of issues as chair of that committee. And the one that I remembered where there was that consensus then, as I said earlier, on both sides was that it would be done by a physician. And I just wanted to set the record straight because I was left with the impression by one of the earlier speakers that's a proponent of the bill that that would be one of the outcomes by having national standards that a licensed physician would be the one that would be required to perform the abortion. It would be a rather interesting area of the statute to take a look at if you haven't already. Another one that is in here that's kind of interesting is that it shall be performed in a hospital or abortion facility if the abortion is performed after the first trimester in a manner consistent with the lawful rules promulgated by the State Commissioner of Health. The only thing I was wrong on when I began to think back, I thought we passed that statute in 1973. We actually passed it in 1974. So with that, I'm just trying to provide some information here.
The member from Hennepin, Representative Allen.
Thank you, Mr. Speaker. And I just wanted to respond. There was a comment made about the
that Hennepin County and that women in Hennepin County should that we should be concerned about their health. And I think if we talk about this, we don't talk about motives or, but really the issue when it comes to a bill like this that imposes burdens on access to abortion services, the majority of constituents that I represent don't believe you. So what they do believe in is that access is something we regulate under our constitutional framework. So they do believe that the legislature is concerned about women's health, but that we have, that we regulate it in a way that doesn't unduly burden women's access. And that's the constitutional framework, that's women's health. And what we do believe, what I believe, is I believe that, I will say pro-choice, in our community we say anti-choice, but that growing up in a religious family, it was Episcopal, but it's like one step removed from Catholic, only because of King Henry VIII, I believe. But you have a sincere a belief in this, and I respect that. That is righteous, and so, but that is not, as Representative Halverson said, not the law of the land. So when you bring forth bills that do nothing to provide, to offer medical benefits or protections that we don't already have, you're not enhancing women's health. The protections we have in place are adequate. You bring up the horrific case where were unsanitary conditions that were endangering women's health. But as it pointed out in that Supreme Court case, those were criminal acts. And we know that regulation, you could put more money into having more inspectors, but licensing doesn't deter criminal behavior. And so that is not it was rejected in the Supreme Court case that there was no evidence that the benefits, the surgical licensing, the physicians' admittance, that those things offered any benefits, that those actually, if were in place, that they would have deterred this criminal behavior, that was not persuasive to the court. So we live under the law of the land. It is this access to abortion is something that is regulated, it is not prohibited. And so I understand, if you talk about something, your views on prohibiting something, I respect that. And there is a place and a time for that. And you would have to either, change the Supreme Court makeup, which it's maybe moving that way. Gerrymandering will get you there. But this here, it just doesn't fit within our constitutional framework, and the constituents that I represent don't believe you. And so, if like Representative Liebing said, if we can have a discussion about regulation, meaningful regulation, we're not against that. But it's not. But that's, to me, is not a conversation that is even meaningful. We don't have those types of conversation on abortion access, because I don't think that can happen, because it's your side believes that it should be prohibited, and our side believes that it should be regulated. And I don't see, it does not believable that you would regulate something that you want to prohibit. So again, we have this constitutional framework, and it always frustrates me that we can't talk about that. And if you don't prescribe to that, then we shouldn't be talking about it at all.
The member from Blue Earth, Representative Considine.
Thank you, Mr. Speaker. Will Representative Lomer yield for a question?
She will yield. Representative Considine.
Representative Lomer, you said you had 8 pages of licenses that you had looked up. Are there any of them whose goal and purpose was to prevent somebody from going to get a medical procedure that they deem necessary?
Representative Lomer.
Thank you, Mr. Speaker. And Representative Considine, any licenses that would prevent them? Am I understanding your question? I'm not sure I'm understanding your question.
Representative Considine.
Thank you. Are any of the licensing requirements designed to prevent a Minnesotan from going and getting a medical procedure?
Representative Lomer.
Thank you, Mr. Speaker. Not that I'm aware of.
Thank you, Representative Lomer.
The member from Washington, Representative Lomer.
Thank you, Mr. Speaker. Well, I apologize for standing up again, but I did neglect to say one of the most important pieces of information, and we talked about this in committee a little bit. I used to sidewalk counsel for an organization called Pro-Life Action Ministries. I used to be there to help young women who were considering abortion, to give them alternatives, to give them help and hope, and not to coerce or anything, but just to be there as a support if they were in crisis. And so I'm very familiar with that organization and with folks that still do that. And they told me that since September of 2016, there have been 6 ambulance calls to the Planned Parenthood on Midway, or on University Avenue. And Assistant Commissioner Pollack happened to be at the committee that evening, and so when we moved on to the next bill, I followed him out in the hall, and I asked him if the health department would be investigating these ambulance calls just to see what on earth, what's that about? 6 times in less than a year. And so he did tell me that he would do some checking, and then I got an email several weeks later that basically said that because of privacy concerns, no information would be available. And members, I'm trying to imagine that an ambulance would come even one time to any facility operating in the state of Minnesota, and it wouldn't be looked into. That we're not going to look into that? It's just beyond my understanding that we're not going to try to figure out why there's been an ambulance at the mega Planned Parenthood 6 times since September. So I just wanted to address a couple of other things. Representative Allen and Carlson and Murphy and Halverson all talked about the fact that we have licensed physicians working in these clinics, and it's part of the law. But my question to all of you, and I'm not going to ask you to yield, but I wish someone would stand up and say, how do you know that that is who is operating in these clinics? How do you know that? If there's no inspection, no regulation, no licensing, how do you know that the staff is who they say they are when they're there? How do you know that? We don't trust any other entity in the state to just take our word for it. Let's just take our word for it that, yep, these are licensed people. So that's what we're asking for. We're just asking to make sure that the women in the state of Minnesota are safe and are being treated by licensed professionals. Thank you.
Member from Polk, Representative Kiel.
Well, members, Mr. Speaker, members, I thank you very much for the debate, the discussion about whether or not we should license an abortion facility. I happen to believe that that will be an important way for us to secure women, provide their safety and health, and when they go into an abortion facility, they are expecting that it has been licensed, it is clean, there's not a problem, and that they can proceed with whatever, even if they're not looking for an abortion, but they're looking for other healthcare issues or questions, that they will regard those, they will be safe and expect that. In fact, I have discovered in discussing with constituents, not always pro-life, pro-choice also, they look at me and they say, they're not licensed? No, they're not. Now, I know we can have that conversation about the doctors and their license, and certainly we expect that they all abide by their license. But folks, we have a huge story, a gentleman that is not much of a gentleman and is residing in a prison now because he risked lives of women. Has anyone here ever heard of sepsis or MRSA? Those are serious, deadly infections. Nursing homes really worry about passing those around. And I know for a fact, I take care of an elderly aunt that just passed away. She got sepsis more than once, and they were telling me, you better get here because we don't think we're going to be able to handle it. But that can also happen in an abortion facility if they are not following regulations. I want to point out some things to you in this regulation, let me read it correctly. It's the 2017 Clinical Policy Guidelines for Abortion Care from the National Abortion Federation. You've been hearing all kinds of things about it. When a medically induced abortion happens, this is what they say. It is safe and effective method for pregnancies beyond the first trimester when performed by trained medical officials, offices, freestanding clinics, ambulatory surgical centers that may be important to later gestational ages. But there's a whole list of standards and practices that they must follow if they are going to provide a later abortion, abortion of a third trimester. And I'll just read a few of them here. It says that when feticidal injections are employed, they should be provided through a standard protocol. They can either do option 1, which is an intra-amniotic, intrafetal injection of digoxin, which would be administered transabdominally or transvaginally to cause the fetal demise, or they can do an intracardiac potassium chloride that would be used to create a fetal demise. I can go on with there's more detail there. But when I look back here, obviously, if you think about that, that woman would have to seek a little sedation because I'm guessing that would be a tough procedure to be awake for. So then we look back at the procedure care, and one of the standards is that all patients who receive moderate or deeper sedation or exhibit signs of instability should continue monitoring until evaluated in the recovery room and determined no longer a risk for hemodynamics instability or respiratory depression. Don't want to send her home until she's stable, and we want to make sure that she's okay. The clinic must remain, the clinician must remain at the facility until all the patients are medically stable. All patients are medically stable. So this is just a few of them. I can talk about some more, but I think you get the idea of what we would be following. And there are certainly all kinds of detail in this policies that would help. I've heard a lot of conversation about, I don't really think you're serious, you just really want to get, you don't want abortions. Listen, folks, if I were trying to get rid of abortions in Minnesota, this would not be the bill I am carrying. Absolutely not. This bill is to help women who expect to go into a facility, seek some medical advice, and receive an abortion. Something that they expect to be healthy, safe, and able to walk out. Dr. Gosnell didn't provide that for women. They died. There were serious things that happened. We can talk about criminal acts. Those are criminal acts, to take someone's life. We want to know in Minnesota that women can seek an abortion and not worry about not walking out of that facility. And it happens, folks. There are all kinds of things that happen in medical procedures. We know that. We go to doctors and doctor says this is how it'll go, and you can expect to be out in so many hours. And I can tell you, folks, I had a knee scope, and they told me, you'll be gone in 3 hours. Folks, I was there 9 hours. Turns out I don't do well with anesthesia, and spent quite a bit of time there. Another comment that was made is this letter from the American Congress of Obstetricians and Gynecologists. This is dated April 21st. Yes, in fact, it does talk about, I can't remember even who read it, about the legislation is not about safety. But folks, this was in regards to an ambulatory center when we were promoting, when the bill was about outpatient surgical clinics, when we were talking about the building itself, the doorways, the hallways, the air condition, the air quality in those facilities, that we need to make sure that they are, that was the bill then, and that's not what we're doing now, folks. This bill says that we want women to be able to secure an abortion, to be able to go into that facility and expect that her life will not be, her demise will not happen, let's put it that way. Or there are other things that are not handled by facilities. And we can go into, I've got stories about places where the staff was working in the front of the desk, they're written books, and they ended up back helping an abortion. It's kind of why they quit, because they realized what they were doing. But in our abortion report for Minnesota for January through December of 2015, the 2016 hasn't come out yet, here's some of the things that happen. We talk about how safe it is. Well, here we've got 1 cervical laceration. We've got hemorrhaging problems, 5 of those. It's a total of 77 women that have experienced these things, but there have been infections that have required inpatient treatments. There are uterine perforations. There's failed termination of pregnancies, meaning the baby was viable. Incomplete termination of pregnancy, which meant they had to go back again. There were a total of 77 in 2015, and I realize that's out of 10,000 abortions, or close to that. So members, when we talk about changing the scope of this bill, the intent is, once again, women must be the priority, not the abortion industry. We cannot shield abortion facilities from even the standards required by their own organizations at the risk of women's lives. Members, with that, I would ask you to vote green and vote for women. Thank you.
There being no further discussion, the clerk will take the roll on the bill. Clerk will close the roll. There being 79 ayes and 53 nays, the bill is passed as amended and its title agreed to.